Massive spike in COVID cases across the country. It's become a cause of huge concern, viewers, as India's Omicron tally has breached the 1,500 mark. The centre has written to states cautioning them over spike and asking them to gear up preparations. Let's take a look at some reports coming in. Over 27,000 COVID cases on Sunday, forcing states to boost preparedness. Amidst lockdown-like curbs in many cities, including Delhi, Mumbai and Bengaluru. India surpassed the grim milestone of 1,500 mark of Omicron cases on Sunday, with Maharashtra topping the charts. Centre issued advisory to states to prepare for the worst and activate district-level surveillance. Delhi's positivity rate also soared to a 7-month high. But Delhi Chief Minister Arvind Kejriwal reassured, saying cases are mostly mild and hospitalization is low.
जो लोग कोरोना से बीमार हो रहे हैं, उन लोगों को लगभग किसी को भी अस्पताल जाने की जरूरत नहीं पड़ रही. सब लोग माइल्ड केसेस हैं, छोटा मोटा खांसी बुखार.
Maharashtra is contributing maximum to India's increasing COVID tally. But people were still seen flouting COVID norms in iconic Marine Drive and key markets. After New Year festivities, Karnataka witnessed cases rising up. But public places are still crowded.
In the last 24 hours, the state recorded some 1,033 cases, out of which 810 are from Bengaluru itself.
Tamil Nadu too witnessed a sharp rise in COVID cases, but crowds in popular Chennai market continue to throng.
Daily positivity rate, which was on 600 plus on Wednesday, has once again increased and gone up to 1,400 plus by 1st January of 2022. Not just that, the Omicron positive cases have also increased. In fact,
West Bengal has announced closure of all educational institutions. Offices have been allowed with 50% workforce. Only essential services allowed from 10 p.m. to 5 a.m. Whereas in Patna, 17 frontline workers have tested positive after Bihar reported a sharp rise in COVID cases.
On 31st of December, the last day of the year, we saw that there was a massive surge in COVID cases. 281 cases were reported across the state that day, and out of which 136 were only in the state capital of Patna.
Is India ready to handle a possible third wave? That's the big question. Bureau Report, India Today. Okay, let's get you the ground reports. Cases are rising. Mumbai, we have Pankaj Upadhyay from Kolkata, Suryagini Roy from Bangalore, Nolan Pinto, and in just about a while from now, Milan Sharma will join us from Delhi. I want to first start with Mumbai because Mumbai is on fire at this point of time. Pankaj, cases are rising. The highest positivity rate for Omicron coming in from Mumbai at the moment. Is this due to higher amount of testing? And what is the administration now doing to contain it? There is a scare of the third wave looming large. Is the infrastructure prepared?
Jyoti, first of all, the state has 460 Omicron cases, out of which Mumbai itself has 327. Now, members of the Maharashtra COVID task force say that the third wave has already entered the state. And some members also maintained that the community spread of the virus has also started. So these are two big statements that have been made by COVID task force members. And that is the reason why the officials in the health department has already sent the standard operating procedures for the various districts. A deadline of 15 January has been set for the various districts by which they need to upgrade their existing infrastructure. It has been said that yes, even though the hospitalization with regards to Omicron cases is less, but still, be it the ventilator beds, oxygen beds, ICU beds or general beds, there has to be full preparedness. And the task force members have gone on to the extent of of saying that just presuming that the fatalities would be even just 1%, even if the case count comes to 80 lakhs in the third wave, there could be fatalities numbers around 80,000. So everyone needs to be very, very careful now, and it says, and authorities maintain that this is a myth. People maintaining that in Omicron virus, the hospitalization is going to be very less and that they can let their guards down. This should not happen at all. And that is why strict fines are being imposed at all the places in Mumbai and nearby areas. And the authorities have warned that all those establishments as well, be it malls, hotels, restaurants, that flout the rule will have to pay heavy fines if rules are not followed. Today's numbers are yet to come, but it is being said in Mumbai the COVID count could go beyond 8,000 today. So the COVID scenario in Mumbai,
I must say, Pankaj, that Mumbai is following a lot of these COVID guidelines quite well. Whatever little I could pick up from the past couple of days that I was there, it looked like the administration is really implementing the guidelines quite well for the moment. But the cases are rising. All that we can say is mask up, socially distance, sanitize, vaccinate yourselves, and all those rules that we've been speaking about apply even now. Let's go to Nolan Pinto, who's joining us from Bangalore too. I request Pankaj, you to stay on with us. Suryagini, stay on with us. Nolan, what's the situation looking like in Bangalore at the moment?
Well, in fact, for the past few days, cases have actually steadily risen. Yesterday, in the past 24 hours, the calculation was that 1,033 cases, positive cases in the state, and out of that, 810 in Bengaluru itself. Now, we have a curfew which is going on over here in the night curfew from 10 in the night to 5 in the morning. In fact, the officials now state that if the situation gets worse, then tougher measures will be implemented. But the issue is this. While the government on the one hand says that people should follow COVID-appropriate behavior, people should wear their mask, hygiene, if you actually step onto the roads in the city of Bengaluru or get out of Bengaluru, people do not follow these rules. And that is one of the reasons for this particular surge that we are actually seeing in Karnataka. Now, in Bengaluru itself, the chief BBMP commissioner, Govt, has stated that they are implementing strict protocols, increasing containment zones, increasing surveillance measures. They believe that with these measures, they'll be actually able to control the surge. But until and unless people, the common man, follows these rules, the COVID-appropriate behavior rules, the government will not be able to do much.
Absolutely, Nolan. That's good to know that the government is taking all the measures that one requires. I just want to take this across to Suryagini as well, who's joining us from Kolkata. Suryagini, can we allay some fears? Is there any reason for people to panic? What are the cases looking like? Are they mild because of the vaccination? What's the situation like in Kolkata?
Well, Chaiti, Kolkata was West Bengal was one of those cities or one of those states where night curfew or any restrictions were not imposed during the last week of 2021. But however, the government seems to have finally woken up, and right now, from tomorrow, there will be a huge array of restrictions. Specifically, that offices need to operate with 50% capacity, and all school, colleges and universities will be closed. Secondly, and the most important thing that the government has come up with is that it has brought back its share of night curfew. So post 10 p.m. till 5 a.m. night curfews will be back in the city and the state as well. One thing that we do see over here, we are at one of the busiest marketplace in Kolkata. A lot of people are wearing masks, and I'd just like to show you how the Kolkata police is sharing their message of wearing masks. And there are these pickets where people who do not have masks, they are being given these masks so that people do wear the mask. So this is a very impressive step by the Kolkata police as per now that we can see. But yes, cases have risen. We still haven't got today's health bulletin so far, but yesterday's one, when it comes to Kolkata itself, 2,300 people are infected as of yesterday. We hope that this number, if it gets down There will be nothing like it in the new
Then
year.
I request all our reporters to stay on with us. We're getting some breaking news coming in and I'll have to cut straight across to it. Just hold on right there. There's breaking news is about capital. COVID surge continues. COVID positivity rate has surged to 4.59% in Delhi. 3,194 new cases of COVID in the past 24 hours itself. The COVID death in the past 24 hours, the tally is 1. So 1 person has died due to COVID in the national capital. The tally is rising in terms of the number of cases that are reportedly positive. The positivity rate has surged to 4.59% here in the national capital. 3,194 new COVID cases in Delhi in 24 hours itself. Questions arising on when will it all end? Teens in the age group of 15 to 18 will be getting COVID vaccine starting tomorrow. Registrations for walk-in and online booking of vaccine has started on Saturday. Health Minister held a key meeting on teen vaccination. Children will receive their vaccination certificate on Arogya Setu. They can also download it from CoWIN portal. Only Bharat Biotech's Covaxin shots are available at the moment. Separate vaccination centres will operate. In Delhi, 159 centres have been identified. Medical teams will be appointed in government and private schools by Tamil Nadu. In Mumbai, vaccines will be provided free of cost to children, free of cost to municipal schools. Vaccines at government hospitals will be free, but if you're trying to get it from a private hospital, it'll cost you 1,250 for your child.
कोविड के केसेस डेली बढ़ रहे हैं, तो हम बाहर जाते हुए हमें डर लगता है कि कुछ हमें कोविड ना हो जाए, तो इसलिए हम सेफ फील कर पाएंगे, हमारे पेरेंट्स भी हमें अलाउ कर देंगे बाहर जाने के लिए।
वैक्सीनेशन के लिए कल के लिए रजिस्ट्रेशन हो चुका है मेरा, इसलिए जरूरी है क्योंकि अभी कोविड के बहुत ज्यादा केसेस बढ़ रहे हैं ना, और हमारे पेरेंट्स अलाउ नहीं करते घर से बाहर जाने के लिए। अभी जैसे वैक्सीनेशन हो जाएगा तो अच्छे से बाहर वगैरह जा पाएंगे, कॉलेज वगैरह रीस्टार्ट वगैरह कर पाएंगे हम लोग, और अच्छे से स्टडी कर पाएंगे।
Kids are the most vulnerable at this point in time. So that's the responsibility of all the parents, and thanks to the government that they have really taken up this. And I'm really, hopefully today I will get the registration done and get over with. It's a responsibility as a parent and also as a citizen that we must get as many people vaccinated. I have a daughter who's 12 years old, so she's the next in the line.
हमें पूरा यकीन है कि ये वैक्सीनेशन बच्चों के लिए भी उतना ही सेफ होगा जैसे एडल्ट्स के लिए था। जो भी ट्रायल्स हुए हैं बच्चों पे इस वैक्सीन को लेके, अभी तक उसमें से ऐसी कोई भी डेटा नहीं आया है जो सजेस्ट करे कि कोई सीरियस साइड इफेक्ट्स होगा। तो जैसे एडल्ट्स को या किसी भी वैक्सीनेशन से थोड़ा बुखार, थोड़ा हाथ में दर्द हो सकता है, वो साइड इफेक्ट्स जरूर हो सकते हैं बच्चों में, बट उसके अलावा ऐसा नहीं लगता कि और कोई सीरियस साइड इफेक्ट्स होने के चांस है।
We are right now present at BKC Vaccination Center. This is the biggest vaccination center of Mumbai, and tomorrow at 11 a.m. Guardian Minister Aditya Thackeray will be over here. He'll be inaugurating the children vaccination camp over here, and by each vaccination center, there are total 9 vaccination centers. At each vaccination center, around 500 vaccines will be kept for children between the age group of 15 to 18. There are over 9 lakh children eligible between this particular age group. So BMC initially will be watching how there is a response. If there are more children coming to the vaccination center, the vaccines doses will be increased. For private sector, that is the private hospital where this vaccination camp will be happening, that will cost you around 1,200 per dose. The BMC is also planning to vaccinate children in schools and colleges. With camera person Vijay Desai, this is Saurabh Bhaktania in Mumbai for India Today.
The COVID-19 numbers are surging in the national capital as well as across the country, but the only sigh of relief right now is that the registration process for the vaccination of teenagers between 15 to 18 has started from today. Union Health Minister Mansukh Mandavia appealed the parents to make sure that they register on CoWIN and come forward to ensure that their children get the vaccinations. The vaccination process will begin from 3rd of January. I'm at BLK Hospital where the preparations, at Delhi's BLK Hospital where the preparations to begin the vaccination center for the age group 15 to 18 has already begun. I'm joined by Medical Superintendent of the hospital, Dr. Suhas Parnami.
The protocol has not changed much. So the initial step is to book an appointment online. There is also an option that you can walk into the center and come as offline as well. We have dedicated this space as for the vaccination of age group 15 to 18. As you can see, we are already ready. We will be starting our vaccinations from 3rd of January. We have already started booking, opened the slots for the 1st of January, and the slots can be booked. So that will make the process easy.
Vaccination process for vaccination of age group 15 to 18 has already begun. Those who want to get vaccinated can register either online or come on 3rd of January and do it offline. And the health experts right now are trying to assure that because the trial and tests have been already done, there is no need to get skeptical about this particular vaccine. Different hospitals in Delhi have already started preparing themselves for the vaccination process that would begin on January 3rd, when the doses will be given out to the age group 15 to 18. But the vaccine this time around would be only Covaxin. With the video journalist Zia, this is Amit Bhardwaj for India Today from Delhi.
France is the 6th country to report more than 10 million COVID-19 cases since the pandemic began. It's joined US, India, Brazil, Britain and Russia for having record level of high cases. Here is how France is coping with the COVID surge.
France has now become the 6th country in the world to report more than 10 million COVID-19 infections since the pandemic began, according to official data published on Saturday. This news comes as health authorities in the country confirmed more than 200,000 daily COVID cases for a 4th straight day. France joins the United States, India, Brazil, Britain, and Russia in having had more than 10 million cases. French President Emmanuel Macron warned the next few weeks would be difficult, but during his New Year's Eve address did not mention a need for more restrictive health measures, adding that the government should refrain from further limiting individual freedoms. Meanwhile, the government said earlier on Saturday that from Monday, wearing masks in public spaces would be mandatory for children as young as 6. And some big cities, including Paris and Lyon, have reimposed the wearing of masks in the street for everyone.
Israel has reported new infection of corona, the Florona disease. A pregnant woman who was admitted to a medical facility for giving birth was detected with Florona. That is what media reports have indicated. However, the young woman was not vaccinated. Florona disease, viewers, is a double infection of COVID-19 and influenza. Here is all you need to know.
After Delta, Omicron and Delmicron, now brace for Florona. Double viral infections threat hits Israel, triggering new scare. Combined infection of COVID-19 and influenza infecting a pregnant, unvaccinated woman who was hospitalized. The Florona double whammy sparked unprecedented worry among health experts around the world. Here is the new double infection decoded. It is caused due to a severe lapse in immune system because 2 viruses jointly attack the human body, possibly due to lack of vaccination and neutralizing antibodies. The possible symptoms of Florona include pneumonia, myocarditis, or inflammation of heart muscles causing chest pain and other respiratory ailments like serious breathlessness. The Florona case comes at a time when Israel has approved 4th booster shot for people with weak immune systems. But should India, which suffered a terrible second wave followed by an Omicron spike, be worried? Health experts have suggested full vaccination and COVID-appropriate behavior key to battling any new infection like Florona. Bureau Report, India Today.